Good evening. I am your moderator for tonight's Wednesday Wellness webinar. Tonight's speaker is a graduate of Doctor of Medicine at University of Santo Tomas College of Medicine and Surgery. She took up her residency training in general psychiatry and had her fellowship in child and adolescent psychiatry in University of the Philippines, Philippine General Hospital. She is a diplomate of the Philippine Board of Psychiatry. She also took Masters in Public Health in the same university, College of Public Health. Currently, she is a clinical consultant in Manila Doctors Hospital, Makati Medical Center, and De La Salle University Health Sciences Institute Medical Center, a faculty member of De La Salle University Health Sciences Institute College of Medicine, a member of the Philippine Psychiatric Association, a member of research committee also of PPA, a manuscript editor of the Philippine Journal of Psychiatry, a founding member of the Philippine Society of Child and Adolescent Psychiatrists, a member of the Philippine Board of Child and Adolescent Psychiatry, and a founding member of the Southern Tagalog Group of Psychiatrists. My dear colleagues, let us give a virtual applause to Dr. Josefina Vasquez-Genuino, who will give a lecture entitled Riding Out the Pandemic, Burnout, or Bummed Out. Doctora, the virtual floor is all yours.
Good evening. I am Dr. Vasquez-Genuino, a child psychiatrist, tasked to discuss burnout and how to differentiate it from clinical depression, as well as how to prevent burnout and its complications. Burnout is not a clinical disorder and is not in the DSM-5 TR, which is the diagnostic and statistical manual that mental health professionals use to diagnose mental disorders. This latest edition was just published this year. There is a category on occupational problems that may be a focus of treatment, but burnout per se is not mentioned. In the ICD-11, published June 2018 by the World Health Organization, but began its use only this 2022, does have a category called burnout and refers specifically to a phenomena in the occupational context and should not be applied in other areas of life. It is classified under problems associated with employment or unemployment. In the section on factors influencing health status or contact with health services. I hope that with the lecture today, I can clarify what is burnout and how it relates to other psychiatric disorders, and perhaps rethink its use in clinical settings, since it overlaps with true clinical mental disorders. So, what is burnout? Herbert Freudenberger, a psychoanalyst, was the first to use this term and describe it specifically. In his ethnographic paper, Staff Burnout, published in 1974, he described what he himself went through while he volunteered in a free clinic in New York after his office hours that started in 1970. He described burnout as becoming exhausted by making excessive demands on energy, strength, or resources in the workplace. Additionally, in 1980, burnout was said to be the cost of high achievement to the point wherein the person wears himself out by excessively striving to reach some unrealistic expectation imposed by himself or by the values of his society. Maslach, Schaufeli, and Leiter in 2001 defined burnout as a psychological syndrome that involves a prolonged response to chronic interpersonal stressors on the job. He stated, or they stated, three main characteristics: total exhaustion, increasing cynicism, and a subjective ineffectiveness or inefficiency. Then in 2019, the World Health Organization stated that occupational burnout is a syndrome resulting from chronic work-related stress with symptoms characterized by feelings of energy depletion or exhaustion. There is also an increased mental distance from one's job and reduced professional efficacy. Although burnout may cause persons to seek consult, the World Health Organization does not consider it as a medical condition or mental disorder, but rather merely an occupational phenomena. That is, it is something that happens in the workplace. Burnout is a syndrome, not a medical or psychiatric diagnosis, caused by chronic workplace stress that has not been successfully managed. Therefore, external factors such as those from the workplace dysfunction are primarily to blame for burnout. What are the core symptoms of burnout? One is exhaustion. This is the most essential feature of burnout and presents itself both mentally and physically. People feel emotionally drained or exhausted, unable to cope, demotivated, dissatisfied with life, doubt themselves, and feel sad or lonely. Physically, they don't have enough energy. They always feel tired, along with some difficulty in sleeping. There are changes in appetite. They experience frequent headaches or muscle pain, stomach or bowel movement problems. Depersonalization. This is a feeling of indifference, feeling numb. And in psychiatry, it is the persistent or recurrent feeling of detachment or estrangement from oneself. This is often an indication of anxiety. Although depersonalization may be considered a means of protecting the healthcare worker from becoming too involved or attached to their patients, it is important not to lose our compassion for our patients. The third core symptom of burnout is reduced personal performance or decreased sense of accomplishment. It is manifested as having difficulty concentrating, being listless, lacking in creativity, being disinterested with the job, that they become inefficient, and the quality of their work performance deteriorates. There is also a sense of disappointment at one's inability to attain one's goals or expectations. Another way of categorizing burnout symptoms would be the following. The physical signs consist of feeling exhausted and tired, being susceptible to infections that Freudenberger mentioned as an inability to shake off a lingering cold due to decreased immunity. There are frequent headaches, gastrointestinal disturbances, changes in appetite, sleeplessness, and shortness of breath. Emotional symptoms would be sad and angry, irritable and frustrated. Mental changes are noted in the person being rigid and inflexible, believing that they know more than everyone else. Freudenberger also mentioned that some persons have a sense of omnipotence, which leads them to take unnecessary risks. And in our case as healthcare workers, this could have catastrophic consequences when dealing with patients. Behavioral signs include difficulty holding in feelings or being emotionally labile, instantaneously irritated or being easily angered, or socially withdrawn. They tend to spend more time at work instead of going home on their off hours and misuse of alcohol as well as other illegal substances. Or they may also engage in other addictions such as gambling, computer games, or internet surfing. Burnout symptoms vary depending on which phase of burnout the person is in. So what are the 12 stages of burnout? These were developed by Herbert Freudenberger and Gail North in 1992 and did not occur in any particular order. But stage 1 is considered a compulsion to prove oneself. This phase is characterized by excessive ambition and perfectionism. The employee wants to excel at work with an almost obsessive fear of not giving more than his 100% to the job and readily accepts any responsibility given to them. Freudenberger and North in 1986 said that when love, recognition, and approval are not present, they leave a hungry void, and low self-esteem drives a non-realistic quest for excellence, recognition, and approval. This drives them to work harder, which is the second stage. the stage of working harder. There is an intensity in continuously wanting to exceed oneself and others. The employee feels compelled to do everything on his own, unable to delegate tasks and to complete it quickly, urgently, and sometimes rushly. Stage 3 is when the person begins to neglect their own needs. They tend to perceive this tough situation at work is normal and actually describe it as being comfortable with it. Social needs are seen as being secondary and tends not to interact socially. Thus, there is no work-life balance as the person focuses on work alone. In fact, colleagues who pursue their social needs would actually be looked down upon. The lifestyle becomes more and more unhealthy, and the first small errors begin to show up. In stage 4, dismissal of conflicts, more and more conflicts with colleagues or the spouse and family arise as the employee dedicates more of his time at the office or clinic, and when at home is busy doing paperwork. But despite his efforts many times, he tends to forget appointments, comes in late, and has backlogs at work, never being able to keep up with all his responsibilities and tasks. In other words, the employee becomes less efficient, yet still unaware that there is anything wrong, even if he already is having a lot of difficulty falling asleep and also has somatic complaints. The fifth stage is distortion of values. There is a change in the way they perceive and value things. They become insensitive and emotionally blunt, tough and calculative towards friends and family. People who are important in their lives earlier now become secondary. The concept of time is disturbed, and only the present is seen. The personal horizon becomes narrow, and they give up their hobbies, viewing these as irrelevant and unnecessary, since work is now their number one priority. In stage 6, there is denial of the emerging problems. In this phase, the affected individual finds the job increasingly stressful and frustrating to the point of becoming cynical and bitter, gradually cutting off from the outside world and isolating themselves further, that is, unable to communicate effectively, and they also tend to be suspicious of their coworkers. Their behavior becomes dominated by impatience, intolerance, and latent or overt aggressiveness. They see their colleagues as stupid or lazy, demanding or undisciplined. Performance deficits as well as physical complaints become more evident. In the seventh stage of withdrawal, or social withdrawal and disengagement, the spouse, the family, and friends are now seen as a burden, or even as being hostile. Criticism is no longer tolerated, and the affected persons describe a feeling of loss of orientation and helplessness. In order to feel good, they turn to other means of gratification, again, such as drugs and alcohol, or other vices. Yet they continue to work more as required by the employer or administration. In stage 8, there are already obvious behavioral changes. At this point, nothing seems to matter anymore except work. Martin Seligman in 1975 described patients with burnout as being apathetic. They may also start showing signs of paranoia, wherein everyone is seen as a threat or that other persons are attacking them. And any additional demand at work is seen as a burden, and so sometimes they try to evade it. In the stage 9 of depersonalization, individuals in this stage describe a loss of contact with the self. They see themselves as machines that simply have to continue working, regardless of whatever else is going on in their life, including other personal, social, or health issues. They no longer see the inherent value of their coworkers or even of themselves, and begin to perceive their lives as being meaningless yet inescapable. Stage 10 is inner emptiness. In this phase, the individual feels completely dejected, blank, useless, fed up, anxious, phobic, or panic-stricken. They try to fill the void they experience through overeating, sexual promiscuity, as well as increased intake of alcohol and drugs. In depression, stage 11, this is characterized by feeling lost and unsure, in deep despair and self-hatred. They look at future as being bleak and dark, and sometimes do not want to wake up in the morning and may even consider killing themselves, or they become suicidal. Lastly, burnout syndrome. In this phase, physical disease, mental and emotional collapse occur and may be considered as needing medical and psychiatric attention. This is a depiction of the cycle of 12 stages of burnout. We notice how the burnout syndrome has such a wide range from mild to pathological symptoms. The key then is to take note of the early signs of burnout, perhaps stage 1 to 3, and provide some intervention for such persons to prevent it from progressing into a clinical or psychiatric disorder. In stage 4, when the employee tends to be dismissive and ignores the fact that there are conflicts at home and at work, this could readily be a sign of burnout that could readily progress into a clinical depression as there are sleep and appetite changes by this time. The body is the first to be aware of the stress and is already reacting to the intense emotions that are being brushed off and denied by the individual. Thus, the need for early intervention. In other words, the organization or administration or colleagues and family should already insist on addressing this rather than going along with the person as if nothing is wrong. With stage 5, there is a distortion of values. Once the employee has difficulty leaving work in the office and takes it home, concern with the children and family may severely drain his energies and intrude on all aspects of his personal life and relationships. Energy investment at work needs to be balanced with a life outside of it. At this stage, there is a need to trust someone who will really listen to what the employee wants to share regarding his feelings or difficulties. It is important to conduct group meetings at work where dialogue and communication may begin in an atmosphere of openness, equality, and respect for each other, regardless of rank or position in the organization or hospital, and where work-related concerns and complaints can be immediately and concretely addressed. Perhaps the same thing could also occur at home if there are issues at home. The denial in stage 6 is a protective means for the person to remain unaware of his imperfection. There is a conflict between the individual's idealized image of himself versus the real imperfect image that is denied. Burnout is the result of this denial, and healing happens through a process of awareness and integration of the denied part. Stages 4, 5, 6, and 7 are signals that the organization or administration needs to address the employee's issues. That is, sit down and talk in a relaxed, friendly, and concerned manner, since a happy employee will make him more efficient and effective at work. And of course, improve the quality of care, especially for patients, and in turn improve the reputation of the hospital. By the time the employee or healthcare worker, that is, all of us, are observed to be moody or irritable, taking alcoholic beverages or illicit drugs and engaging in other vices, or become socially isolated, or have interpersonal problems with colleagues, superiors, and subordinates, then perhaps it is really time to seek professional help or consult, either a psychologist who may provide initial evaluation and therapy, until perhaps they will notice that there is a need for referral to a doctor to rule out, for example, medical or endocrinological problems, and then later to a psychiatrist once cleared medically or neurologically. And if the patient still continues to manifest mood and behavioral changes, then yes, you need to probably go to a psychiatrist after all. Even before the obvious behavioral changes appear in stage 8, we can already intervene and seek consult. In stage 9 of depersonalization, we can consider this detachment as a protective strategy. As healthcare workers, we are torn between being sympathetic and caring, yet maintaining clinical objectivity. And more so since the start of this coronavirus pandemic. If we care too much and become emotionally attached to our patients, we may burn out. But on the other hand, if we become too detached and lose any concern or empathy for our patients, then we lose our humanity and become less effective caregivers. Now, once an employee is in stage 11 and has suicidal thoughts, we must be alarmed and alerted. We simply cannot ignore these ideas, even if seemingly passing or passive. And all cases of self-harm, whether intentional or or not, should be referred to psychiatry. A newer perspective on burnout describes just 5 stages of burnout. The symptom of burnout shift as it progresses from the early phase of increased commitment to goals and enthusiasm known as the honeymoon stage, which is present when a person just starts working. He may be satisfied with his job, still optimistic, willing to take on all responsibilities assigned to him, and has sustained energy levels. So ganado pa. At this point, the person is committed to the work with a compulsion to prove himself and has free-flowing creativity that results in high productivity levels. In time, however, this becomes associated with experiencing the stresses of the job. With the onset of stress arises the usual burnout symptoms, as mentioned earlier. This stage of stagnation begins with some days being more difficult than other days, and life becomes limited to work, while family, social, and personal needs are neglected. Again, as time passes, if there is no change in the work situation, which is now a persistent stressor, and there are no positive coping strategies initiated, then it becomes chronic stress. Here, the employee may complain of persistent tiredness and exhaustion, feel resentful, pressured, and threatened with a cynical attitude that leads to social withdrawal, procrastination, alcohol and drug consumption, decreased sexual desire, and aggressive behavior, yet will deny having any problems. At this point, individuals feel frustrated, powerless, and view themselves as a failure. That is, despite all the time and effort they dedicate to the work, the results don't seem to be at par, or it's never enough. And if they do not receive enough acknowledgement from others at work, this will make them feel more incompetent and inadequate, that they now begin to have decreased commitment towards patients and others as well as towards the work itself, or a negative attitude towards the increased demands of work. Eventually, this will lead to apathy, okay, or burnout, pagod na, where disillusionment occurs, where people do not see a way out of the situation and become indifferent or resigned. Persons at this stage become obsessed with problems and take on a pessimistic outlook. They are filled with self-doubt and continue to isolate themselves socially. Their physical symptoms of headache and gastrointestinal discomfort become chronic, yet continue to be ignored, aside from ignoring the other personal needs. Instead, the person further tries to escape by getting addicted to alcoholic beverages, drugs, or other vices like gambling or computer games. And they also begin to manifest more aggressive behavior, such as blaming people or having a lot of angry outbursts. And lastly, if there is no intervention initiated, the individual will eventually go into what you call habitual burnout, wherein there is chronic sadness and depression, mental and physical fatigue that leads to reduction in cognitive performance. There is demotivation, lack of creativity, a judgmental attitude, flattening of emotional, social, and intellectual life, as well as psychosomatic reactions, and ultimately despair. Once there are obvious behavioral changes, burnout symptoms may overlap with a psychiatric condition such as adjustment disorder. This is a milder psychiatric disorder that is described as having emotional or behavioral symptoms in response to an identifiable stressor that occurred within 3 months. So you have a stressor, then up to 3 months from the time of that stressor, the patient develops symptoms. These symptoms may last up to 6 months from the time the stressor occurred and its consequences have terminated. It is specified as having depressed mood, wherein there is low mood, tearfulness, and hopelessness, feelings of hopelessness. Some may have anxious mood characterized by nervousness, worry, jitteriness, and separation anxiety, while there are others who have a mixed depressed and anxious mood. How do we differentiate burnout from clinical depression? In other words, are you burnt out or bummed out? For us to say that a patient has a clinical depression, psychiatrists use the DSM-5 TR criteria for major depressive disorders, wherein 5 of the 9 symptoms should be present for at least 2 weeks. So there should be a depressed mood and a sense of hopelessness. There should be a diminished interest or pleasure in all activities. There are appetite and weight changes. So there's either increased appetite or decreased appetite, and therefore increased weight or decreased weight. There is insomnia or hypersomnia. There is psychomotor agitation or retardation, wherein the patient also complains of feeling restless or they feel slow down. They may experience fatigue or loss of energy. They also feel worthless and they have a sense of inappropriate guilt. They have diminished ability to think or concentrate. They tend to be indecisive, and they may also have recurrent thoughts of death and suicide. So that could be suicidal ideas, suicidal plans, suicidal intentions, or even suicidal attempts. Specifically for major depressive disorder, either number 1 or 2 must be present, plus 4 of the other 7 symptoms. And these should be present for 2 consecutive weeks, which leads to a deterioration in work and social functioning. In depression, negative thoughts and feelings aren't only about work, but all other areas of life. Other typical symptoms of depression which are not in burnout would be having low self-esteem, and like we mentioned earlier, the hopelessness and suicidal tendencies. So people with burnout don't always have depression, but burnout may increase the risk for someone to get depression, to develop depression. So perhaps we can say that burnout is work-related and doesn't affect one's day-to-day life. But once it affects every aspect of your life, and there are persistent feelings of hopelessness, worthlessness, and helplessness, then we are probably now dealing with clinical depression that requires psychiatric intervention. The symptoms that are said to be a result of burnout can generally have other causes, like mental or psychosomatic illnesses, or depression, anxiety, or chronic fatigue syndrome. But physical illnesses or certain medications also can cause symptoms such as exhaustion and tiredness. So it's also important to consider other possible causes first together with a doctor, and not to conclude that a person has burnout right away. What are the causes of burnout? So who is at risk for burnout and eventually depression? There are personality or individual factors, which was elaborated by Fisher in 1983, and this is known as the integration model of personality-related and environment-related etiological factors. for burnout. In this model, the precondition for the development of burnout is a complementary interplay of factors in the employee's personality and environmental triggering factors. For example, you may experience burnout at a higher rate if your job requires a heavy load, or there's an understaffing, or there are conflicts in the workplace, or the job is not rewarding, even if you do a job well. According to Freudenberger, in describing his observations of himself and his colleagues at the free clinic, he said that those who are dedicated and committed tend to be the people who also burn out more quickly because they feel the pressure from within. They have the pressure to work and help aside from the pressure from outside. The individual has an excessive need to give more than he actually can, failing to meet his own high expectations. The person now begins to feel guilty, and this spurs him to work even further or even more. Engagement and commitment can either be a sign of maturity or an indication of the employee's neurotic need to be accepted and receive approval from others. The overly committed worker uses work as a substitute for his personal life, and all his gratification in life comes from the institution that he works for, and he would rather spend time in the hospital than to go home. The healthcare worker identifies with his patients or hospital that he works in and may view any criticism on his patients, the hospital as an attack on himself, and vice versa. There are also those who feel the need to always be in control and thinks no one can do the job as well as he can, and so he prefers to do everything by himself rather than delegate it to others. On the other hand, Freudenberger also looked at the bigger picture and described how the wider political and socioeconomic issues can come into play, stating that without being able to effect change in the immediate surrounding community can be a frustrating task. It is like doing band-aid treatment when major surgery is called for. And for him, helping out their patients one at a time was merely to attend to the symptoms of the disease, rather than tackle the root of the problem. Thus, he felt there was also a need to be as much concerned with making sick institutions healthier as well as making individuals healthier. Work in large organizations can become fragmented and meaningless when the worker finds himself in a situation where he cannot communicate with the decision makers in the company. This leads to what Freudenberger called a functional burnout, that is, a burnout generated by the system itself. So these are some of the environmental factors that Fisher listed in detail. High demands at work, such as heavy workload, understaffed, there's time pressure, there's increasing responsibility, pressure from superiors, or contradictory instructions are being given, problems with leadership and collaboration, conflicts within the organization, problematic institutional rules and structures, hierarchy issues, administrative constraints, lack of clarity about roles, having a bad atmosphere wherein there is bullying or harassment going on, poor internal communication, a lack of teamwork, a lack of resources or social support from coworkers, a lack of perceived opportunities for promotion, lack of organizational influence. There are few opportunities to participate with decision making, a lack of freedom to make decisions, and there's no positive feedback given. It is evident that the etiology of burnout is multifactorial, with internal or individual or personality factors playing an important role alongside with external, organizational, or societal factors. Burnout is thought to occur when a mismatch is present between the nature of the job and the job the person is actually doing. A common indication of this mismatch is work overload, which sometimes involves a worker who survives a round of layoffs, but after the layoffs, the worker finds that he is doing too much with longer working hours, yet have too few resources. There is a lack of control when there is an inability to influence decisions that affect your job, such as your schedule, assignments, or workload. When there are unclear job expectations, that is, you're not sure about the degree of authority you have or what your supervisor or others expect from you. A dysfunctional workplace dynamics is when there are bullies or colleagues who undermine your authority, your efforts, your accomplishments, or they don't appreciate your work or badmouth you to superiors or others, and this can contribute to job stress. When a job is monotonous or chaotic, you probably need constant energy to remain focused, which can also lead to fatigue and job burnout. As healthcare workers, our job of helping can be considered stressful by its very nature, and more so when there is a pandemic, as you have to deal not only with your own health risks, that of your family, and also of your patients. Lack of social support can make one feel isolated and at a loss how to handle problems, difficulties, or stress from work. An inability to balance work and personal life, that is, if your work takes too much of your time and effort, that you don't have any more energy to spend with your family or your friends, or for yourself, you will burn out quickly. So, what is the impact of burnout? How does burnout of personnel or healthcare workers affect the overall function of the system, the organization, or in our case, the hospital? What is the impact of burnout on the individual? If left unaddressed, burnout becomes chronic or habitual and may lead to medical conditions such as hypertension, heart disease, and type 2 diabetes. There is decreased job satisfaction. This would result in communication breakdown, frequent absenteeism, more rapid turnover in personnel. There would be low morale, cynicism, and decreased productivity and efficiency in the workplace. There could also be increased risk for accidents, both at work and outside. These effects at work frequently have repercussions on one's personal life, such as feeling unhappy, anxious, depressed, isolated to the point of actually fulfilling their criteria for a psychiatric disorder, either perhaps a thought, mood, anxiety, or a substance use disorder. Burnout in physicians may have more serious professional implications than in other professions because it could result in poor patient care and medical errors, which in turn would lower patient satisfaction and potential malpractice suits and ultimately destroying the reputation of the healthcare worker and the hospital they work for. So these are some statistics I found in the literature. The 2020 Medscape National Physician Burnout and Suicide Report stated that the burnout rate was about 43%. Most studies agree on the fact that there is no real gender effect in the incidence of burnout, but the data from the Medscape National Physician Report indicate that women physicians reported more commonly symptoms of burnout. In 2015, 51% of the female versus 43% of the males, and in 2020, 48% of the females reported burnout versus 37% of males. A study among general practitioners showed that exhaustion and fatigue occurred equally in both sexes, but the feeling of lack of efficacy was more common in women. So what can we do to prevent burnout? That is, even before a clinical depression develops. Negative consequences of burnout on both the employee and the organization requires preventive measures in order to reduce the impact of the risk factors. Burnout prevention strategies can address the general working population, which is primary prevention. For secondary prevention, it is when we target those with high-risk personality factors and those who also work in stressful situations, such as healthcare workers or during this pandemic. And lastly, for tertiary prevention, this is when we attempt to reduce the impact of burnout itself or its complications. So primary prevention is addressing the whole system and is applicable to all, even before there are any signs of burnout. These are strategies on how to prevent burnout. First, let us look at what can the organization or hospital do to remove the disconnect between the administration and the staff, personnel, or doctors practicing in a particular medical center. Organizationally focused interventions produce longer lasting positive effects than those individually oriented. Thus, changing aspects of the organization's culture and working practices would be more effective in preventing occupational burnout. And when there was managerial involvement and support for these interventions, it was noted that there was greater likelihood of positive effects. It is best to combine individual and organizational level strategies that include a system change, such as adopting a participatory environment, promoting open communication, supporting both managers and peers, enhancing a culture of learning, and persuading employees to participate in both the planning and implementing of programs. Resolving the discrepancies between the demands of the work and compensation for the employee requires an integrated action on the part of both the individual and the organization. First of all, the organizational values and goals should be clearly stated and in sync with those of the employees or hospital staff, so as to improve their commitment. A supportive leadership and harmonious relationships among all healthcare workers and hospital staff would be helpful. One approach for addressing unfairness and other conflicts in the workplace would be to have weekly discussions so as to immediately resolve any perceived inequities in their jobs and hopefully minimize exhaustion, cynicism, and inefficiency. Allowing workers or doctors or hospital staff to have more control over their job has helped lessen exhaustion and cynicism in the workplace. Providing adequate rewards and benefits could provide the necessary incentive to increase job commitment. Both the Marmot Review and the National Institute for Health and Care Excellence recommend a strategic and coordinated approach to preventing burnout. They highlight various situational and organizational factors that play a larger role in preventing burnout than individual level factors. These organizational factors are allowing job autonomy, providing job security, providing opportunities for promoting employees' mental well-being, giving opportunities for flexible work hours, facilitating staff engagement, instilling a culture of participation, equality and fairness, as well as strengthening the role of line managers. Several studies on burnout among healthcare workers have shown that job characteristics and institutional factors that contribute to well-being include the following: promoting autonomy, adequate office resources, and support staff, facilitating a collegial work environment, allowing physicians to influence their work environment, participate in organizational decisions that affect medical practice, and have more control over their time schedules have had a substantial positive effect. Efforts to minimize work-home interference by providing flexible scheduling, childcare adapted to irregular hours, were also important for increasing the employees' well-being. With regard to workload, the organization should assure that the worker has adequate resources to meet the demands, as well as allowing them to balance work with family, friends, and self. Providing a satisfactory life-work balance could revitalize employees' energy. Individually, what can we do? In a study by Sheepers et al. In 2019, burnout prevention programs that included cognitive behavioral therapy, didactic stress management, and relaxation exercises, as well as mindfulness, were found to be effective in preventing occupational burnout among medical personnel. Additional prevention strategies would be, for example, starting the day with a relaxing ritual such as yoga or prayer. Another could be adopting healthy eating, exercise, and sleeping habits. Setting boundaries between work, home, and leisure. Taking breaks from technology. Cultivating one's creativity. And learning how to manage stress were also effective in allaying burnout. Again, for all, it is important to nurture close and supportive relationships, both at home and at work. Thus, there is a need to spend quality time with family, friends, and yourself as well. Self care practices in which we actively explore personal interests and talents, gain self awareness on our own or with the help of a mental health professional, as well as having regular medical checkups, should be our responsibility. Another important aspect is to have a positive outlook in life and to find meaning and fulfillment in your work so that one enjoys work and therefore it is no longer work but just fun. You may opt to work part time or choose other aspects of medical practice such as teaching or research, or maybe even merge your various interests like poetry and dance, incorporate it into your clinical practice or administrative work. A less often area of intervention in promoting well-being is religious belief and or spiritual practice. This refers to nurturing spiritual dimensions of yourself through prayer and meditation. It has been reported that up to 34% of persons mention this aspect to be important and even essential. Secondary prevention is geared towards those at high risk for burnout, such as those working in critical care settings or hold controversial or difficult positions in the hospital, as well as those who have high risk personality factors mentioned earlier. The following are some strategies that can help you prevent burnout, not just for those who are at high risk for developing burnout, but can be also used by everyone or applied to everyone. So it can be both a form of primary or secondary prevention, depending on the target population or who is actually applying it or using it. And in a way, if you prevent burnout, then you can also prevent the sequela of chronic burnout or the complications of burnout, which is the psychiatric disorders, as I mentioned before, anxiety, depression, substance use, or addiction. So one would be expanding your support system. Widening your circle of friends is important so as you can have someone to talk to or share your thoughts, fears, and feelings so you do not feel alone or isolated. And especially since most likely all that we are experiencing and feeling are normal and common, considering this prolonged pandemic period. Another is the more you know, the less fear that you may experience. Knowledge is power, and if you have a problem, you try to learn whatever you can about it and figure out what you can do about it. So there'd be less fear. Any form of regular exercise you enjoy can help relieve mild to moderate depression and anxiety. They say that having sex can also build confidence and self worth. Intimacy within a committed relationship can help you feel good about yourself and boost your self esteem. Develop a passion by investing time in a new hobby. Find something that you enjoy, that you're interested in outside of work. Having a hobby and taking pride in it is a great way to boost self esteem. Nurturing your mind is also as important as nurturing your body. So learning a new skill or studying another vocational or college course could rekindle your zest for life and the world. Eat and drink healthfully and in moderation. Although alcohol and food are good stress reducers, it is only if it's in moderation. You can eat what you want and enjoy as long as you eat in smaller portions. At the same time, get regular exercise so that you maintain your healthy weight, because this will also be important for maintaining physical and emotional health. Engaging in relaxation exercises, meditating, or practicing yoga to relieve stress. There is a range of relaxation exercises that include deep breathing and relaxation of muscles, at the same time clearing the mind from all worries and thoughts, or imagining an idyllic scene you like, whether it's up in the mountains or by the ocean. You can practice yoga, tai chi, shibashi, and other relaxation techniques for which you must take time and make time for at least 15 to 30 minutes 3 times a week. Other strategies would be managing your time by setting up weekly goals. If you make a schedule and set goals for yourself for the week, you'll be more on top of your days. And when you're more on top of your days, then you're more on top of your life. As you cross off the tasks that you have on your to-do list, you will feel a sense of accomplishment and as if you're progressing. So that will help reduce stress. Getting enough sleep to maintain energy and increase productivity. People who get a good night's sleep wake up with more energy and tend to be more productive. If you're overly tired, every task and responsibility becomes a burden. Small problems become like big problems. Research suggests that having fewer than 6 hours of sleep per night is a major risk factor for burnout. Poor sleep can have negative effects on your job performance and productivity. Sleep has actually been shown to improve one's memory. Recovering from chronic stress and burnout requires removing or reducing the demands on yourself and replenishing your resources. So sleep is one strategy for replenishing those resources. Learn to say no and refrain from overextending yourself. If you try to do more than you can handle, you will only end up frustrated and stressed out. If someone asks you to do something you absolutely cannot do, just say no, kindly but firmly. Unplug. While communication technology can promote productivity, it can also seep into your family time and add stress. So you should set boundaries by turning off cell phones during dinner or weekends and delegating only certain times to check your messages and respond to these emails, for example. Get organized. Often when people are burnt out, they spend a lot of time worrying that they'll forget to do something or that something important is going to slip through the cracks. But if you get yourself organized, clear your head, put together a to-do list, then prioritize what you should do first. That way you don't have to keep thinking about those things because you'll have systems in place to remind you. Stay attuned. It's important to tune into the precursors of burnout. For example, physical signs will show that you are under too much stress, like headaches, tight shoulders, a stiff neck, frequent stomach upset. In terms of mental health, burnout can also lead to you becoming depressed. So if the issues you're struggling with are really serious and getting worse, you may need to seek professional help. Know when it's you and when it's them. Know where the stress is coming from. Is it something at work or is it something about yourself? Also, figure out when enough is enough. Is it time to move on? Maybe change jobs remove yourself from this stressful situation. Or perhaps you could talk to your manager or HR about mental health benefits or stress management training, and also try to improve communication and create better, more positive work environments. But if there's no change, then perhaps it is time to move on. Tertiary prevention is applicable for those who are already at the end stage of burnout, which actually depicts a clinical or psychiatric disorder. At best, referral to a mental health professional is immediately warranted, so that some form of psychotherapy and medications may be given. And if medications are needed, especially for those who have sleep and appetite changes or difficulty in concentrating, then a psychiatrist would have to be the mental health professional that you consult. The sooner that psychiatric intervention is received, then the better we're able to prevent further complications of depression and anxiety. These complications are increased substance use and suicide. We also want to prevent further deterioration of the work and social function of the individual. Again, the complications could be getting laid off from work, committing unethical or serious medical and surgical errors, which could lead to litigation or medical legal cases being filed against the doctor or hospital staff. Other complications would also be breakup of marriages and families. So if despite your efforts at healing and helping yourself, symptoms of burnout, anxiety, depression, or even addiction begin to affect other areas of your life aside from work, then it is time to seek help from another doctor or mental health professional. So, with that, I thank you for listening and hope that we can all ride out this pandemic without getting bombed out or clinically depressed.
Thank you, Dr. Genuino, for that insightful lecture that truly helps us differentiate burnout from clinical depression. Let us now go to the question and answer portion of this webinar. First question, Dr. Hello, good evening po, Dr. First question po. Nowadays, young adults easily give up on a given task when faced with difficulty, get bored at work when repetitive, and quit when they feel like it, since jobs not requiring degrees are increasing in number these days. What can we do to prepare our children who will be facing this kind of challenges in the future?
Okay. Well, I hope you didn't get burned out with my lecture. Ang haba. Anyway, napasobra ako sa oras. So I guess with regards to preparing our children, I mean, personally lang, I just feel that if you don't make life that easy for them, that maybe that will help them get used to being challenged, even as young as they are. Of course, the challenges we give them would be developmentally appropriate at each stage. Yeah, but I think that's important because I don't know, the parents that I see, with the cases that I handle, I noticed that some parents tend to like maybe spoil their children, and they don't want to give their kids a hard time, or like for example, the issue of computer games, that's always like a constant battle between parents and children, that the kids just don't want to let go of their gadgets, like katabing matulog, kasama sa banyo. Parang hindi mo nga pwedeng i-check di ba? Kung gusto mo mag-random check, hindi mo ma-check kasi laging katabi. Tapos kahit tulog sila, hinawak mo, parang nagigising na agad. Parang ganun sila. So parang even that one, no? The fact that you have to give them like certain times that they can use the gadget. I mean, that in itself is difficult for some because some are just like on it the whole day, especially when it's vacation time. So I just feel that maybe you need to like set limits and be firm with it. And I don't know, kung naawa ka, tiis-tiisin mo lang muna. I mean, di naman mamamatay ang bata kung walang computer games, di ba? Parang, I mean, nung panahon ng parents natin, wala pa nga ang telepono, di ba? Ano ba, 1920s ba yun? Or wala pang phone noon or something, di ba? And when did cell phones come in? I mean, was it 1980? I'm not sure. Pero parang ganon. Tama ba? Tanda ako na kasi. So yun. I mean, I think we just have to give them challenges. Give them like household obligations, household chores, give a routine. Hindi pwedeng play all day, you know, and then just give them what they want. It just can't be that way because that's not how life is, right? And I think that's how come like we have a lot of young cases, I don't know, 11, 12, 13, depressed and suicidal already. Simple reasons, you know, like boyfriend broke up, I don't know, napagalitan ng magulang, pero parang, ano ba, di ba? Di ba pwedeng pagalitan ng bata? Hindi nga tayo mamalo na eh. Di ba pwedeng sabihan man lang or pagalitan? I don't know. Although depende, no? Some parents do tend to maybe belittle the child or constantly always get angry at the child. Then maybe the child always begins to feel unloved, unwanted, and so forth. So I guess, yeah, depende rin, no? I mean, I guess you have to balance it as well, no? Giving them affirmation that they're valuable and so forth, that they're important, that you love them, you know. So, but nonetheless, we could give challenges, things that they have to do.
Opo. Yung you said na baka nakakaawa. Baka nakakaawa if later on mas nakakaawa sila if they cannot adjust.
Yes, yes. Especially nga, mahina ang tolerance for frustration.
Yes po.
And that's what life is all about. I mean, it's like one problem after the next, isn't it? I mean, it sounds dismal, but I mean, there are still good moments and happy moments worth living for. But then, of course, there's always something that you don't like, diba? Or it doesn't come out as you had expected. Diba? Ganun ang buhay eh.
Yes,
Up and down. So,
thank you,
masanay na habang bata pa.
Yes, correct po. Agree. Okay, next
Oo.
question po, Doktora. Difficulties cannot be avoided in our line of work. Exhaustion and fatigue can really be felt. If a doctor cannot adjust to these situations, how can they effectively treat their own patients? So I don't know. I think this is
How
a
to
comment,
adjust.
a comment or not really.
Yeah. Yeah. So that's true, no? I mean, like this pandemic, initially, we were all so scared to go out of the house, to go to the clinic, and super paranoid. I guess it was kind of stressful, especially, well, for psychiatrists, because I could just sit home and do my teleconsultation, di ba? Pero like pediatricians, and especially if you're infectious disease specialist or pulmo or something like this, you would have to go to the clinic, right? And you're risking your life twice or three times, you know. So yeah, I can just imagine the stress. I don't know, if you get a bit tired, you could limit your practice if you wanted, you know, like maybe take a break now and then. It might sound a bit selfish, I guess it is, but I don't know, no? I mean, kanya-kanyang kakayanan yan eh, di ba? So we cannot, if you can't naman handle it na, take a break. Diba? Okay naman yan. Then there are others naman who can cover for you or something like that. So yun. I guess we can't be too harsh to ourselves as well, diba? You have to, syempre you have to take care of yourself. Parang ganun. Yeah.
Doktora, follow-up question po dito. What is your best advice to prevent burnout among residents in training?
Okay. I'm not sure, but di ba the clerks and interns like in LaSalle, I know they've been given like, I think it's 12-hour duties lang sila.
Yes,
Parang ganun na sila. Tapos baka we can do the same thing for residents. 12-hour duties lang sila. I guess it would depend on how many residents you have also in the hospital. But baka that could be an option na pwedeng on-call na lang sila after yung the next 12 hours or something like that. I don't know, depends on the... Pwede ba yun? Hindi ata pwede, ano? Pero ano, like what you mentioned kanina, siguro yung mga ano, like meditation exercises, like in the beginning of the morning, sabay-sabay sila, mag-group relaxation sila or something, or group prayer. And then middle of the day, yung talagang protected time for their meals, for example, yung ganon. Baka yun siguro ang makakatulong for them, so that they're not like 24 hours, 7 days a week on call or something. something like that. Basta give them a lot of rotations para hindi masyadong sagad yung oras nila. Diba? May time for themselves also. And if they're married, then they need time for their families as well.
Yes po.
Or yeah, maybe higher salary. Hindi naman din, no? Hindi enough yun
Para
eh.
ma-motivate.
Yeah, pero hindi. Kahit anong pera, kung pagod ka eh.
Pagod, opo. Yun po.
Oo.
Sige pa, next question, Doktora. If all personal interventions were done and not effective, then what should a person do next?
Like yung mga, assuming that we had done relaxation, talking to friends, like that.
Mhm.
Well, if you've tried everything and somehow you still feel stressed, maybe you could try seeing a psychologist, maybe, if that would help first, and just someone else, a professional to talk to. And then it's up to them. For me naman, the psychiatrist usually comes in. Depends kasi on your willingness also to see the psychiatrist. But if it's just initial consultation with any mental health professional, psychologists would be okay naman kasi they're more, I guess, there's less stigma going to them. And the only time that you would probably have to really go to see a psychiatrist if you need medications that in for like sleep and appetite changes, difficulty in concentrating, or kahit despite several sessions with the psychologist na hindi pa rin siya gumagaling, no? Hindi pa rin siya ahon dun sa depression or anxiety niya, then you might want to consider seeking a psychiatric consultation, if ever. Something like that. But definitely you need to like do all the self-help, like relaxation, eating well, sleeping well, having time for yourself, vacation time with your family, and then of course having your support groups, your family and your friends, your colleagues, pwedeng ganun din, nag-usap-usap, diba? Parang ano, like when we had like the disasters, like earthquakes or volcanic eruptions, diba? Nagkakaroon tayo ng parang debriefing ang tawag doon eh, mga ganun sessions. Pwedeng ganun. Even among the residents, you could have sessions like that na parang nag-uusap lang, sharing. And some activity that they enjoy. Like I remember in psychiatry when we had residency before, we would do coloring books. We would color, and habang nagko-color, nag-uusap, o kaya we watch movies together as residents. Parang yun yung mga, I guess, de-stressing activities that we had. So.
Correct, tama. May iba rin po yung may nakakausap din na ilalabas.
Because I think we're all going through the same thing, especially with the pandemic. It's like everybody is really experiencing the difficulties of it.
Next question, Doctora. There is an increasing number of cases of depression nowadays, particularly in adolescents. Some even have recurrent suicidal thoughts. Would it be beneficial for them to be placed in an institution where they can be monitored and attended to 24 hours a day? Or would it be helpful if they stay with the family, though family members will also feel stressed out due to the situation?
Okay. Well, I guess depending on the family situation, if they're already the ones causing the stress and making the child want to kill themselves, then maybe a separation from maybe that particular family member or lipat lang sa ibang relative. I wouldn't like immediately recommend putting them in a hospital or institution. Only if I would only recommend hospitalization if nag-attempt na siya talaga. And if when we ask them about the suicidal ideas, do they actually plan to do it, or do they really think they will do it? If they're not sure, depende sa family yon. Pwedeng bantayan nyo in a sense na may kasama lang sa bahay all the time. And of course, let's not add stress to the child, like pagalitan or something. At the same time, we're not going to spoil them also, but just it's the matter of how you talk lang to them, diba? Like gentle and firm, like that. Hindi yung pasigaw, pagalit, nag-iinsulto na agad, hindi ganon, no? But yeah, usually if the person has a strong intention of killing themselves, depende yun sa family, how willing they are to cooperate with applying suicidal precautions at home, which is like what we always tell the families is tagulat ng mga sharp instruments, lahat ng ingestible items, be it like biogesic, ano man, Clorox, rat poison, lahat ng malunok, di ba? Itago nyo. Muriatic acid is
Yes,
like,
yes,
I just found out muriatic acid is like the worst you can take, no? Kasi it has burns and then you end up having to have surgery, tatanggalin yung duodenum, etc. It makes the situation even worse. So anything ingestible, anything that's sharp that they can use to cut, and ropes, wires, etc. And of course, guns and any other dangerous weapons sinatago. And then we never leave the person alone in the house. Pwede mag-isa sa kwarto kasi hindi naman pwedeng parang hovering ka, di ba? Wag masyadong halata kasi they also get irritated with that. So parang hindi mo siya pahalata na nakabantay ka, pero nakabantay ka talaga. And you just come in for like, whatever silly reason you can come up with. Anak, kumusta na? Gusto pang kumain? Wali ka, no? Tayo. Whatever. Parang any reason lang. Just so, na-check mo siya every now and then. Pero may kasama sa bahay. And then you have to have access to the room. Siyempre may susi ka. Yung mga ganon. If the family can do that and they're willing to do it, it's okay for me for the patient to stay at home. And I've actually done that before. And then what I did was I'd see the patient like every week talaga. Because at least I'd say, okay, she wants to die now. O sige, teka, magkikita pa tayo next week, ha? Okay ba? Parang gano'n. Kita tayo ulit, ha? O naman siya. So hanggang umabot kami ng mga ilang buwan na gano'n, no? Maybe initially a few months every week. Then after another few months, maybe every 2 weeks. Depende na how she's getting along. Then eventually, naka 6 months plus or minus na din. Yung ganun ba? So time has passed and hopefully with the meds and everything, she has gotten better and given a reason to live. Yung parang ganun. Nag-enjoy na rin siya. So yun. So I don't necessarily have to say na agad-agad hospital ko kasi you'd feel a bit isolated. Those are strangers there in the hospital institution. So hindi naman ikaw din ganun ka-comfortable, di ba, sa hospital. So, not necessarily. But of course, if the patient has already attempted, like whatever, cut or ingestion of biogesic, definitely, papasok mo muna yan sa ER and then from there, assess ng pedia and psych usually. And toxicology din pala kung ingestion siya. So, yun, re-evaluate na lang. But definitely, we need the cooperation of the family.
Doctora, would you advise na yung family members will also seek psychologist?
Pwede. Yes.
Some of them also get afflicted with
right.
Who has suicidal tendencies.
Yeah, pwedeng meron silang psych problem talaga or somehow the relationship with the child is really so conflictful that there really has to be some kind of therapy for the parent. I mean, whether it's psychiatric or psychological, there has to be some intervention then, because they need to be taught how to parent, I suppose. Parang ganon. Or baka may sariling issue siya, di ba? Baka sa may marital conflict or kung ano man, depende. Yeah, but definitely yes. Sometimes you end up having to deal with not just one parent, but the two parents, and then also maybe even other siblings if they may also be the stressors for that particular patient. So depende din. So family na. Buong family na rin.
Okay. I think that's all the questions that we have, Doctora. Thank you for answering all of them. We are now near the end of this webinar. May I ask you po for your take-home message to our colleagues?
Oh, okay. Well, one take-home message. I just hope that, kumusta ba kayo? Ganun eh. I don't know. I think we just have to try our best with whatever we do and try to, I guess, have faith also. I think for me, that's important. It's not so highlighted in psychiatry or psychology. So, but in the Filipino culture naman, medyo maka-Diyos ang maraming tao, di ba? Whatever religion, doesn't matter. But it's good to, I think psychologically speaking, it's important to believe in a God who you can rely on because when all else fails, right? Nobody else to turn to, and then God na lang. Di ba? Parang ganun. So that's all. I think you just have to keep the faith and continue to hope for the best.
Thank
Yeah.
you. Thank you very much po, Dr.
Sige. Thank you then for inviting.
Your time. Opo.
Yeah.
So this is
We,
the
we,
end of our webinar po.
now I was just gonna say, kasi meron kaming Southern Tagalog group of psychiatrists, so para tayo magkakambal in that sense.
Oh yes, opo.
Uh,
Yes, opo. So, ayun po. This is the end of our webinar. Thank you very much, Dr. Thank you very
Thank
much
you, Ren.
also to the PPSSTC members who attended this Wednesday Wellness webinar. Good night, everyone. Thank you po.
To award the certificates, may I call Dr. George Maravillosa, PPS-STC Secretary.
Good evening, PPS Southern Tagalog Chapter members and participants in tonight's wellness activity. Join me as we award the certificates to the following. The certificates reads, Philippine Pediatrics Society Southern Tagalog Chapter proudly awards the Certificate of Appreciation to Dr. Josefina Vasquez-Genuino for her invaluable contribution to our chapter as resource speaker during our wellness program webinar entitled Riding Out the Pandemic, Burnout or Bump Out, given this 6th of July 2022 via Zoom. Signed by Dr. Maria Carolisa G. Pontanilla, PPS-STC President, and yours truly, Dr. George B. Maravillosa, your Secretary. Same certificate of appreciation is also awarded to Dr. Luneta Villarin for her invaluable contribution to our chapter as moderator for tonight's activity. And of course, the certificate of appreciation is also awarded to Pediatrica Incorporated for their invaluable contribution to our chapter as industry sponsor for tonight's wellness activity. Again, thank you very much for your support. And to all PPS-STC members, your attendance and CPD units in tonight's activity will be credited into your databases. So be updated and join all our chapter-initiated activities to learn and earn more CPD units. Thank you very much and enjoy the rest of the evening. All for the Filipino child.